Welcome to Caregiver Chats. Today, I'm talking about fall prevention, so stay tuned and we'll get into it. Hi, Dr. Lakelyn here. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. Today on Caregiver Chats, we're talking about proactive steps for fall prevention. Many caregivers share with me that they constantly worry about their loved one falling. Understandably so, because falls are common among older adults, with 1 in 4 older adults falling annually. We also know falls can lead to serious injury and a decline in a person's health. The good news is there's a lot we can do to be proactive in preventing falls. I'm so excited to be joined today by my good friend and fellow gerontologist, April Ibarra, to talk more about this. Hi, April. Welcome.
Hi, Lakelyn. Hello, everyone. Thanks for having me.
Oh, the pleasure is all mine. I love when we get to chat about aging issues. And this one is one that you know very well. So could you just start by telling our listeners a little bit about yourself and also how you became an expert on this topic?
Oh, goodness. So, years and years ago, when I first became interested in gerontology, I started off with teaching exercise classes in nursing homes. And I realized just the value of the wellness model in keeping older adults active and well so that they can go into their aging journey, living their best life ever. So that was important to me is to keep people living as well as they can as they do get older, despite all the things that may happen. And what I began to see is falls were not only the leading cause of injury, but they just started to decline people's lives. People became, as I noticed that, they became afraid of falling. Falls changed their experience. So I became very interested in that. And for many, many years, probably over 10 years, I worked for a medical alert company. And I went out all over and really encouraged older adults to learn to stay healthy, to know what to do in case they had a fall, and then also to have a medical alert in case they needed it. So I became very familiar with the topic from those years, and then my passion is just to keep people alive and well, and do not let anything interfere with their path. And falls can do that if we're not careful.
Oh, absolutely. Well, it sounds like you have such a wealth of knowledge and experience that I'm excited to kind of delve deeper into. And you kind of mentioned it already, but why is fall prevention particularly important for older adults, would you say? Like, what are kind of the top reasons why caregivers should be so tuned into this topic?
Yeah. For one, it's not normal, and it's not. Older adults are not the only ones who fall. But unfortunately, when older people start to fall, it means there's something else going on. If you and I trip on something and we fall, because everyone does fall, in all likelihood, it's probably something environmental, right? I tripped over something, there was water, I missed a step, that type of thing. But when older adults start to fall, the people who are caring for them and the older adults should start to recognize, this isn't right, this isn't normal. Maybe there's some underlying causes. And why we should pay attention is it really starts to be a downward spiral. And it doesn't have to be. And by that, I mean, they start to change behaviors because they're afraid of falling. That's a big, big deal. They don't want to tell anybody that it happened because then they're going to be perceived as not able to take care of themselves. And in the worst case scenarios, that fall could lead to something more debilitating. Many times people do end up in the hospital. They have not just a basic fall, but it could be a more extreme where they fractured a hip or, had a concussion or something like that. And then oftentimes they don't always recover.
Yeah.
They can, but they don't. And so that's why I think it's so important is that it's that little thing that starts to just change the way they live, the way they act. And in all likelihood, it's a deeper cause of something else going on that needs to be explored.
Yeah, I think it's key what you said about, if somebody falls, then they might be afraid of falling. We also know if you look at research around this topic, people that fall once are more likely, twice as likely to fall again.
Yes.
So we do need to address it. Yeah.
Yeah, yeah. So it could be that, oh, you see a new bruise on, Aunt Betty's arm and you're like, oh, what happened there? And oh, well, I just, I fell. And then you see it again and again and again. So it's
Hmm.
not a one and done. And usually it is a pattern that we start to see.
Yeah.
And if it's not the first one that gets you, it could be the second or the third, but it's going to happen again. And it's that fear that starts them changing their behaviors. They
Hmm.
stop going out because, well, I'm afraid I'm going to fall.
Yeah.
I'm not going to, get out. I'm going to stay in my chair all day
Yes.
because last time I got up too much or went out to get the mail, I fell. And that really is the worst thing that you can do. That
Hmm.
inactivity and that fear is going to start to create things that are really going to be hard to recover from.
Yeah. Yeah, and I think what's also important for us to keep in mind is even what that we call like a near fall is just as
Hmm.
important to pay attention to. So like if somebody
Yeah,
trips but catches themselves on
right.
the sofa or on the wall, or you might notice in the bathroom like the towel bar looks a little broken or like it's coming off the hinges, that
Yeah,
could be a sign that there was maybe even a near fall too, because those are kind of those
yeah.
precursors to a
Mhm.
potential fall, to your point, that could be worse and that could lead to kind of that downward spiral. And it just,
Mhm.
if we can do things to prevent it, why not? So I think that
Why not?
looking at it through the lens of prevention and also through the lens of helping the older person keep their independence longer,
Yeah.
hopefully that can help make the conversation more approachable. Because as you said, people don't want to talk about it because if they feel like if I admit to a fall, then I'm admitting to other things, like I'm not capable of caring for myself,
Exactly.
or they're going to move me out of my home because
Yeah,
I'm a
that is
fall
the
risk.
biggest that is the biggest fear. So, yes, we need to talk about it, but we have to approach it very carefully. You cannot simply say, "Mom, you're fallen 3 times. This can't happen anymore. We've got to do something." Well, that's like telling me you want to take the wine out of the refrigerator because that's not good for you. That's not going to work, and it doesn't work with older adults either. So, we have to just phrase it in a way that helps them to understand that you're there to listen, you
Hmm.
want to help, and that ultimately the goal is their independence. And there was a psychologist last week that I listened to. His name was Dr. Lester, and he was talking about dealing with behaviors and things like that in older adults. And one approach he had was called SET, which I loved, and it was support, empathy, and truth, right?
Mm.
So, and I love that because you can say, gee, I'm here to help you stay in your home as long as you want. And I understand it's difficult. But the truth is, Mom, you've fallen 4 times and you have had some pretty serious falls. What are you willing to do to make sure that you're safe?
Mm.
Right? So
Yeah.
you phrase it a little bit a different way. It's in their control. You're empathizing, but you got to say the truth too.
Yes.
That last fall nearly killed you.
Mm.
Because I have had that happen to relatives, and they can recover, which is interesting because I love some of the research that's out. Dr. Becky Levy, I'm looking at the book now. I think it's called The Age Code. Really talks about those positive age beliefs make
Hmm.
a huge difference in how well we do. And people who have positive age beliefs, instead of saying, oh my gosh, I've fallen, my life is over, I'm older, I can't do this, I can't do that, their health is going to be much worse and actually can reduce their life expectancy by up to 7.5 years.
Wow.
But if somebody who has a positive approach, research shows that they heal quite well from things where you think this is never going to happen. Right. So we
Mm.
have to have a positive approach about it. It's not the age that's doing it. It's the weak muscles. It's the medication. It was
Hmm.
something in the house. Right. But it's controllable. It's fixable. Let's talk about it.
Yeah. Well, and I do want to kind of dive into a few of those categories that you just listed off. But before we do that, I do think it's also important, since we have caregivers listening to our podcast, to talk about what falls do from kind of the impact on the caregiver standpoint. Because again, I hear so many caregivers say, I'm worried sick that the next time I
Mhm.
go over to mom and dad's house, I'm going to walk in and they're going to be on the bathroom floor and I'm not going to know what to do. So I think from a caregiver's perspective too, we need to empower caregivers to have these conversations and to
Yes.
help their loved ones make some of these maybe modifications to the home or introduce some strength exercises so that the caregivers too have that peace of mind and they're not constantly worrying, because I know that that can really, really weigh on a family caregiver.
It is. Yeah. And I've seen so many families, and I myself have come in and found people on the floor, my aunt and mother included. And it's devastating. So we care so much and we want to protect, but we just have to make sure we approach it in a way. And we can learn a lot by just going in and looking around the house and seeing what's going on. And there's lots of things that we can do, to educate, and we can dig into those whenever you're ready.
Yeah. Well, before we do, let's just take a quick commercial break and then we'll be right back to dig into all of those great points. This podcast is brought to you by Home Instead, an honor company. If you find yourself needing extra support as a family caregiver or time away from your caregiving responsibilities, Home Instead can help. Our home care services are delivered by compassionate care professionals and range from personal care, meal preparation, and medication management to Alzheimer's care and hospice support. Visit homeinstead.com to learn more and to find a location near you. Okay, April, so we were talking about kind of things that family caregivers can be on the lookout for when it comes to fall prevention, things that we can modify maybe in the environment or in someone's kind of day-to-day life behaviors. You had mentioned, strength, exercise, balance. So maybe let's start there and then we can work our way through some of the other things. So I know that can be really important. My grandparents, they go to the Silver Sneakers class at the YMCA 3 days a week. And I know that the strength and balance that they work on helps prevent falls for them. So tell us more about why that aspect is so important and how we can hopefully maybe help an older person get over their fear of engaging in exercise, because I know that that fear can prevent them from doing that.
Yeah. All movement is good movement. That's how I look at it. And I love Silver Sneakers because A, it's free. B, it's socialization, which is powerful, right?
Yes.
So to get out and have a guided instructor or other people that you're with to keep you strong. So, essentially with falls, if your muscles are weak or, there's all kinds of things physiologically that can go wrong with you that can make you more susceptible to falls. Arthritis, diabetes, if you have foot neuropathy. And the problem is many times we really don't know why we fall. Unless it is that environmental thing, like a rug or a dog, which happens quite a bit. Most times older adults will say, I have no idea what happened. 1 minute I'm up, the next minute I'm on the floor, right? So that's the problem. It's hard to troubleshoot, but we know that there are several things that increase their risk factor. And muscle weakness is one, joint instability, balance, being impacted. And certainly medications play a huge role on all of that. So, medication must be addressed. And we can't assume that the doctors know that, they shouldn't be on all of these pills. You really have to have a pharmacist take a look at that. So I think exercise is the best place to start. And again, when I say exercise, some people will go, I don't want to do that. That's great to exercise. Well, okay. Well, then get up every day and go to the mailbox and get your mail. Get up every time there's a commercial and move around and do things. And there's plenty of things that they can do in their own home. But keeping their muscle strength, the reason they cannot perhaps get up from the floor is in all likelihood related to muscular strength. Right. So anything they can do to keep moving, keep their joints, more limber and strength.
Yes. Those are all great tips.
All movement is good movement.
Yes. Well, and now
dancing in your living room is great. That's what my Aunt Joy does. She turns on Neil Diamond and she'll just dance. And I'm like, that counts?
I love that. Yes. Get up and dance. Who doesn't love to dance?
I know. And it makes you happy and increases your endorphins and all that good stuff.
Yes. So I think the key there is finding something that works for that person. Some
Absolutely.
people, they might be the type like my grandparents to go seek out a class. There's
Yes.
also other evidence-based kind of classes that exist out there. Whether it's at your local YMCA or the senior center, or as you mentioned, just things to do at home, those resistance bands, even, your cans of soup for weights, just
Yeah.
even getting up and down out of a chair can be great
Yeah.
for, working all those muscles. So
Right.
continuing to
And
move.
Silver Sneakers does have virtual programs because I know
Great.
for my aunt particularly, she doesn't have a car, she can't get to places, but she has been logging on to Silver Sneakers and doing some classes on demand,
Oh,
which
that's
is great.
great.
So there are some choices, and there are some, what they call evidence-based programs, which is just they're more focused on what they know really works, which is great. But like I said, anything you can do, as long as you're just not sitting all day, and you're not a sedentary, my aunt, again, she lives in a senior building, long, long hallway. I said, if you walk up and down, to the elevator and back 5 times a day, and then once you get good at that, you do more and then you add on. So you can start with anything and it will make a difference.
That's fantastic. Making it approachable. So
Right.
important. And then you had mentioned medication. So let's talk about that. I in one of my former podcasts talk about how sometimes your pharmacist is one of the most accessible healthcare providers because you can just walk right up to the
Yeah.
pharmacy at, the drugstore or your grocery store and talk to a pharmacist. You don't have to make an appointment. And so what we call reconciling medications, which means
Yeah.
having someone review the med list, can be so important. And so, April, you want to talk a little bit more about that?
Yeah, I would probably put this really at the top. First things first, exercise is important, and let's do that too. But in all likelihood, if somebody is starting to have those recurrent falls, there's something else going on.
Mm-hmm.
Okay, so see your doctor. Talk about, the fact that you're falling. Check everything you possibly can. And then with medications, I'm not a pharmacist, I'm not a doctor, but many medications have side effects. Big surprise. We hear it every day on the commercials, right? And many of them do affect balance. And they have a different impact on older adults because medications are not trialed and tested on older adults. So if I'm 70 and I've been on the same medication since I was 40, there's a likelihood maybe my body is processing that medication differently. And then now I'm on a different medication because of this, and this. So you have to reconcile. Go to the pharmacist, say, these are all my medications. I'm now having some falls, some dizziness, some unsteadiness, changes in my gait and how I walk. Which of these might be a barrier? And your physician should be willing to modify based on your needs. But if you don't ask for it, don't assume you're going to get it, unfortunately.
Yeah.
I have to say, I just had a specialty pharmacy. I am on a new drug for psoriatic arthritis. And the Optum specialty pharmacy has been calling me, and I've ignored them. Finally, today I took their call, but I was glad because they were asking me, how is the drug going? Have you noticed any of these side effects? And is the treatment working for you? So I got to have a good discussion about the treatment. And it was an opportunity for me to express if there was an issue. So don't be like me. Don't put off that conversation because this was a new drug and it was important. And fortunately, it is doing me a world of good. So drugs can help certain things, but on the flip side, they can also cause other problems.
That's so true.
So don't assume
Yeah.
anything.
Well, and often,
Yeah.
we're seeing multiple providers too. And often each provider is prescribing something and maybe they don't have your whole medication list. And so that's where
Right.
those issues can come into play. So again, it's really important to have that med list up to date and address any of those side effects, especially if you're starting to see falls after starting a new medication. That could be one of the side effects. And perhaps there's something that can be done to adjust the medication or, other solutions to make sure that fall risk doesn't continue to increase, instead it decreases.
Yeah. And I'd like to mention person-centered care because I think that's really, really important. And what that means is the healthcare providers should look at what is most important to me as the person.
Mm-hmm.
So if I am an older adult and I'm experiencing a lot of different comorbidities and I'm being managed for heart disease and, osteoarthritis and, sometimes there's many things going on. We have to sort of find a balance between managing these comorbidities that works for what's most important for me, right? So if I'm on a drug for something and it's causing a side effect over here that is really wreaking havoc in my life, sometimes you have the right to make some decisions to say, this risk is not worth, I don't have enough gain, right? I'm getting more risk from this treatment than I get, and it's not allowing me to go out and walk my dogs because now I'm too weak. Right.
Yeah.
So I think person-centered care is important. And what that means is you have to advocate for yourself when you're managing all these things and say, well, here's what's important to me. I need to be able to still go to church on Sundays. And I haven't been doing that because of this, this, and this. Right. So you talk about what's important to you, to your providers, and allow them to make a plan around that.
Yes. Yeah, that's a great point.
And it doesn't happen naturally.
Yeah, unfortunately, you do have to be your own advocate, or a lot of times it's the caregiver that's advocating for their loved one. And I often remind caregivers, you know your loved one best too. So you are also going to be kind of clued into when there's something that's a little off. And so, go with your gut, reach out to that healthcare provider and have a conversation. So important.
Yeah.
And then we've talked about, the environmental modifications that can be made for fall prevention. I think, things that come to mind automatically, things like grab bars in the shower and taking away those throw rugs and those kinds of things. But April, beyond kind of those two, what are some other kind of home modifications that people should be thinking about when they think of fall prevention?
Yeah, I mean, good. We're talking about this. I'm glad it's not the first thing we talked about because naturally that's the first thing people think about. Oh my gosh, mom's got all these rugs around their house or there's clutter everywhere. Yep, that's true. And again, you can just take a glance around when you're visiting someone's home and you can say, oh boy, clutter is a big issue, right? So if there's too much stuff, there's no good pathways, and you've got somebody who is already wobbly on their feet and they can't navigate the perimeters because there's so much stuff, that's an issue. And again, you can't simply just say, this stuff's got to go. This is a huge risk. You have to say, okay, again, go back to that set theory and say, well, I'm going to support, I'm going to be empathetic. But the truth is, Mom, what happens if you fall on this stuff and you lay there and you don't get help, right? So kind of going back to the truth. You have to look at the stairs to get in and out of the house. Yes. The laundry is in the basement is a common one, right? It's like, oh, everything's fine. I remember chatting with a lady. She said, oh, my house is just, it's fine. The only issue really is that I have to go down to the basement and these, stairs that are kind of like straight down to do the laundry. It's like, well, maybe could we look at having somebody else help you with the laundry, right? Yeah. Or can we get a laundry upstairs? So you're just really looking at all access. And I know Home Instead has a lot of good tools, some things that you can walk through the home, but you're just looking for, easy mobility throughout the home. You're looking for places to rest when you get tired. So if you're putting on your socks and you're in the bedroom and there's nothing to sit down on, don't stand there and wobble around on 2 feet. Sit down, right? Have good lighting from the bathroom to the bedroom, because I get up a couple times at night. I like to have a little light there because that's where a lot of things happen. Things to hold on to in the bathroom if you are in the tub. I take a bath every night. I've been doing it most of my life. I have a feeling when I'm 80, I'm still going to take a bath at night, but I'm probably going to want to have something to hold on to help me get out of the tub. So it's just looking at those basic things, where they spend the most time. If they're in the living room and they got a chair that's really sunken down, they can't get out of it without a rock and kind of roll. You know what I mean? Yep. and really, because they don't have the muscular strength, that chair may not be the best. in the kitchen, if they can't really navigate everything that they need without reaching too high or reaching too low, can we just move some things around so what they need is easier to access? So just looking at basic mobility where they spend their time and making it as easy as possible for them to move effectively and do those activities without risk.
Yeah, I think that that's such a great reminder and good tip. And to your point, Home Instead does have a home safety checklist, which I'll link to in the show notes, and it does walk you room by room. So if you think through your loved one's routine and the rooms that they're in most often, you can go to this checklist and just gives you things to kind of look around, assess the environment, and then some suggestions on ways to make that environment a little safer. So that can be a great place to start. And we're headed into spring, so you can kind of frame it up in a spring cleaning mindset too, to maybe do a little decluttering. But I think, again, approaching it, I love that acronym SET, with their independence and dignity in mind, and approaching it from a place of, we want to make your environment a safe place for you to feel comfortable in. So how can we work together to make some modifications so that is the case?
Right. And work together is the key, right? Because they're in charge. As long as they're cognitively able, they are in charge. So it's, well, Mom, it's your choice. If you want to fall and sometimes I've been so blunt as to say, well, if you want to fall again and end up in the hospital and possibly the nursing home, I can't stop you. So that is your choice. It's like, oh, okay. That puts it right out there. And even last week at the conference I was at, they were talking about restraints in nursing homes related to falls, because that's a big issue also in institutions, hospitals or nursing homes. And I thought it was very interesting when they said, we cannot, older adults or our residents are allowed to fall. Now, if we try so hard to protect somebody from falling, we're probably going to be doing them harm, right? And in a nursing home, that's where they might use restraints, medication, or tools to keep them in their wheelchair so they don't get up. Well, that's not right. Right? Yeah. Just like when toddlers have to fall, we learn, you know all about this.
Yes, as a new mom.
As a new mom, you can't stop somebody from hurting themselves. But we can look at the dangers of it and be respectful to know that we can't prevent everything. But let's look at all the variables, that could put them at risk, and then put them in charge of making the choice.
Yeah. Well, because
and sharing outcomes.
Yeah. And if you include them in the conversation, then they might feel more empowered to participate, being a willing participant as opposed to being resistant and being in denial. And I think, speaking of, I think sometimes those assistive devices like walkers, canes, those kinds of things, I see so much resistance from an older person because it's a visual sign that I need help and assistance. So do you have any words of wisdom or advice for family caregivers that are trying so hard to get their loved one to use those assistive devices? We know that it's good for their safety, but they just won't use it.
Right. To me, if it keeps it going back to their goals, Mom, well, what's important to you? Well, I miss going to church on Sundays. I miss going out to lunch with my friends, but I can't walk that far. Well, would you rather not do those things, or would you rather do them, but use some support so that you can? Do them. So again, always taking it back to what's important to you. Yeah. And I think most people can accept the fact that they don't like it. We don't have to like everything. There's a lot of things I don't like in life. But if what's important to me, if it gets me from point A to point B, and it's what's important to me, then I might be willing to do it. But if my daughter just keeps insisting that I use the walker, I'm going to say, well, what do you know?
Yeah.
And then, sometimes it just is a battle you don't need to fight.
Yeah.
You just put it in their hands and say, well, there's a couple of choices. If you use your walker, you won't get out of breath, because when my aunt doesn't use her walker and she's going down that long hallway, by the time she gets to the end, she's just out of breath. I said, but you're not with a walker. Isn't that great? So you can get to the end of the hall on your own. You just need this to do it. Oh, yeah. All right.
Yeah, it's all about the way you frame it sometimes.
It's the way you frame it. And they are not children. These are grown people. And we have to be very careful not to treat that. We are not parenting our parents. I don't believe in that personally. And I don't think parents believe in that either. It's like, no, my children are not parenting me. I'm the adult here. Well, then let's act like one.
Yeah.
I sometimes fall back on that. Well, then act like an adult.
The little tough love from April. I love
That's
it.
right.
It's that
I can't be tough.
it's the T in the set, the truth part.
That's right. The
It's
truth is important, and people are so afraid to talk about these things because they just don't know how. And it's planting those seeds. You can't have a one and done conversation.
so true.
Right? You can't just say, "Oh, well, we're going to fix this today. This is how we're going to do it." No, it has to. You plant those seeds, and you will be very surprised if you do it appropriately. How effective it can be. And all of a sudden you're like, you see some changes and you're like, oh, this is exciting. They are listening.
Yeah.
Yes. But give them time
Yeah.
to accept and to process. No one likes to, to have declines and changes that really impact them. It's not an age thing. It's a human thing.
That's so true. So true. Well, a few more things that I thought would be important to mention just in this whole prevention conversation is hearing and vision. Because if you think about it, vision, that seems obvious. We want to make sure the older adult has proper eyewear, keeping up with those appointments with their eye doctor. But actually hearing, what a lot of people don't realize is that there's actually, a part of our ear that really is important for our balance. And so when we start to lose our hearing, it can impact our balance. And a lot of people don't realize that. So keeping up with those hearing appointments, making sure they're using proper hearing devices like a hearing aid can go a long way also in their fall prevention. So April, anything else to add on hearing or vision?
Yeah, no, I think those are two just very basic ones and very important and easy ones to take a look at. And the other one I think I mentioned too is just footwear, which is kind of a common thing. But I know with me with the arthritis that I have now at home, I am never barefoot. I have to have support in my feet, or I do find I have balance issues. So I think just making sure they have good footwear that they're wearing around the house that's that's going to help them manage walking and moving around and is supportive and isn't sloppy, floppy, no shoes tied, things like that. So yeah.
Again, some of these things seem so obvious, but it's really good to have these reminders and to just assess, and then also one other thing. Again, I don't think a lot of people think about even hydration. Dehydration is something, especially we're heading into summer months, a lot of warmer climates in our future. And so in the summer months, we want to make sure that the older adult stays hydrated because that dehydration can cause the dizziness and the falls as well. So keeping, a water bottle nearby or, drinking fluids throughout the day can just be really another important thing for family members and older adults to keep in mind so that they can reduce that risk as well.
Yeah. Yeah. And I'll mention two other ones one that might be somewhat obvious too is dogs and pets.
Yes.
Because, and God knows they're vitally important for everyone's mental health. But if there is a hearing or a vision problem, I've had many people who've fallen over their pets because they can't hear them come from behind very quickly. So one lady said, I put a little bell on him. So now when he sneaks up behind me, I'm not so surprised and I don't step on him. Things like that. And then the other one that people may not think about is older adults may consume alcohol. And that doesn't just end at a certain age. So, I think we also have to understand that if somebody is an older adult and they are have their evening cocktails, what might have been normal for them at 40 or 50 or 60, at 70, 80, they might not be processing that alcohol the same way. So those same two drinks that they would have with dinner or wine or whatever could be impacting them much differently. So we just have to be aware that alcohol could be involved and certainly drugs as well.
Yes.
But when you're taking alcohol with certain medicines, it can have a big impact. So, maybe we, instead of having a glass of wine, we have a wine spritzer with a little bit of wine and a lot of club soda and some fresh fruit. You don't have to tell them, unless they have a problem, that they can't drink, but alcohol can certainly cause falls.
Yes. In all
At
age
all
group. That
I
is
can vouch.
that is another great point, and I appreciate you
Yeah.
bringing that up.
Yeah.
I do want to talk about kind of the technology in this space.
Mm-hmm.
You mentioned that you worked for a medical device company for many years, and a lot of people ask me, should I buy the personal emergency response system, PERS for short, for my loved one. It's like the pendants. And then there's also been some new technologies that have come out, like the airbag belt. April, have you seen this, where it's like a belt that if you fall, an airbag inflates. And to me, that seems a little extreme, but for some people, they might be interested in trying it depending on how often their loved one falls. But
I doubt
yes.
it.
I don't know if
here's why I say that. Here's why I say that. For all the years I spent in the industry, and even now, people do not want to wear a medical alert. Okay. I think they're very important, right? Because many people think they know what to do if they have a fall, and they don't get help, and people can die. And the longer you lay there after an accident and you don't get help, the worse the outcome is going to be. So I am a fan of knowing what to do in case you have a fall, because that's just preparing for anything that could happen, right? Yeah. But if you're not going to wear it, it doesn't help you.
Yes.
Right? So most people just think, well, I'm going to put it on the kitchen counter. Well, gee, when you're in the bathroom floor in the corner, wedged between the toilet and the tub, you're not going to be able to reach it. Mm-hmm. Right. So don't, so if people don't want to wear a medical alert, they're probably not going to wear an, imploding seatbelt thing. So that's my personal opinion. And there is medical alerts now that have automatic fall detection. Mm-hmm. I would recommend, if anybody does get a medical alert, get something that has auto alert type technology. What that means is, if they're wearing the button and they have a fall and they don't push the button, the technology will sense that there has been a fall. And it will send a signal to the daughter, to the emergency response center, to whoever they set up to check on them. And they'll do that through the speaker and the pendant that's on them. So it's good technology, but you got to wear it to use it. There are devices that do not have a wearable button, and it's a unit in the house. And if you have a fall, you just shout for help. And if you shout for help 3 times, then it will call a response center. So there is great technology. So I do think it's important to have the conversation. If you have a fall and you can't get up, what is your plan? Yeah. Right. So teach people how to fall, because quite frankly, sometimes you're on the floor and you just can't get up, but you're conscious. If there's enough stuff in the room and you've kind of practiced, roll onto your side, push yourself up, get over to the hassock that's there in the living room, use that, get the phone, whatever. So be prepared for, if it happens, how would I get up? If I can't get up, what do I do? So have a plan regardless. But if you're going to get that technology because you are at risk, then use it.
Yeah.
Do not put it in the drawer.
It's not going to do anyone any good in the drawer.
Won't do you any good. And trust me, that one day you need it. And I have multiple stories of people we have saved their lives. And so it works, and it's important.
Yes. So check out the technology that's out there if you're a caregiver too. That could be another great proactive step you can take. I know also, I think the latest version of Apple Watches can also detect falls. Yeah. So if you're being met with so much resistance, you could try that. There's also other great benefits. I know my mother-in-law has heart issues, and her Apple Watch can detect if there's issues with her heartbeat. And so, again, utilizing technology as our friend in prevention can be helpful, but sometimes you have to propose it in a way to your loved one, in a way that they'll be accepting of the technology. And like you said, April, use it. So it's all in the approach for that as well.
Yeah. And again, it goes back to, well, what do you want to do? Well, I want to stay at home. I don't want to go to an assisted living community. Okay, great. What are we willing to do then?
Yeah. Yes.
Yeah. Would you be willing to have a medical alert? Would you be willing to, have physical therapy? Because that's another thing. If you've got somebody who's falling all the time, get a PT eval. have Medicare cover that and have them evaluate and help you with some exercises that you can do on your own to strengthen and specifically work on fall prevention. So there's lots of resources. We just have to access them and help them support the goals of that person.
Yes. Absolutely. Well, we've covered so many great tips in our time together today, April. Is there anything else we haven't covered that you think is important to mention as it relates to fall prevention?
I think I'll just go back to what I said about the positive age beliefs. I am just a huge fan now of that research that is supporting the benefits of having that positive age belief. And what that means is it's knowing that, yes, I'm growing older. That's great. And I'm going to embrace this. Aging is good. I'm going to accept the things that come to me, and I'm going to deal with them in the best way that I can. And I'm just going to have a good attitude. And that sounds all peachy keen, but the research indicates it does help prevent dementia. It helps people live longer. It helps you heal. And overall, people want to be around positive people.
Yes.
So you know what? If you're growing older and you're all doom and gloom, it's going to impact you and those around you. So you might as well have a good time, realize that this is a great time of life, be happy about where you are in your life and who you are, and your health will benefit, and so will your social life.
Thank you for leaving us on that positive and uplifting note. And April, if people want to connect with you or follow your work, how can they do that?
Yes, they can reach me. I have a consulting company called Flourish for Life, and you can find me at aprilibarra.com.
Awesome. I love following your work. You have so much of that positivity messaging on your social medias, and it's just always such a great reminder to me. So I'd encourage you all to follow April. And thank you again, April, so much for joining me today. It's been such a pleasure talking to you. It always is. I love our conversations.
We could talk all day long. Nobody would listen, but we could talk. But thank you, everyone, for listening in on this important topic. And you're not alone. And it's a great time to be a caregiver and an older adult. So let's just embrace it and lean into each other. And we have just lots of great things coming our way.
Thanks again, April. As we wrap up today's episode, I want to thank April for joining me and sharing her expertise. It's important to remember that while falls may seem daunting, there's a lot you can do as a caregiver to help your loved one decrease their risk of falling. I hope that these tips and insights we've covered today empower you to take a proactive step towards creating a safer environment where your loved one can thrive without the constant worry of potential falls. I would love to hear how you're helping your loved one prevent falls. You can email me at caregiverchats@homeinstead Inc. That's caregiverchats@homeinsteadinc.com. In the next episode of Caregiver Chats, I will be covering the power of music in caregiving. Music can be a helpful tool that can be used in your caregiving role. I'll be joined by music therapist Tara Jenkins, and I hope you'll tune in to learn more. I also invite you to follow us on Facebook at Home Instead Inc., that's Home Instead INC, for previews of upcoming episodes, caregiving tips, and more. You can find all of these links in the show notes. Thank you for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com/caregiverchats to learn more.